Are you unhappy with the aesthetics of your nose? You're not alone. Nose reshaping is the second most requested cosmetic procedure in the United States. Rhinoplasty has the potential to dramatically improve the facial balance that a well-shaped nose provides. Our practice has collectively performed over 1,000 rhinoplasties and continues to help new patients attain their desired results every day. Dr. Christopher Knotts will give a brief overview of the rhinoplasty procedure to help you decide if nose surgery is right for you.
In general, a rhinoplasty is altering the external appearance of the nose. We are altering the internal part of the nose, the septum, which kind of controls airflow, then we call that a septoplasty. You can do both, and we call that a septorhinoplasty. Probably the most important thing is someone that has realistic expectations. Getting a rhinoplasty is not going to turn your face into a 20-year-old model, and you're not going to get a 20-year-old model nose if you're 80 years old. To a degree, it's nice to bring those pictures in because it gives us some guidance as to what you're wanting to achieve. However, your anatomy really dictates what's possible. Not everyone can have every single nose out there. Coming in with an open mind and being able to kind of receive our recommendations and our feedback will determine whether you're a good candidate for the operation. In terms of the youngest that we would do a purely cosmetic rhinoplasty, I would say teens, and that really depends on the patient and on how fully mature they are mentally as well as skeletally. Another thing that makes all rhinoplasties a little different are people's cultural or ethnic views. Some people want a very strong Roman nose and they want a very high bridge and maybe even want to keep a bump. Others are looking for a much more refined bridge, a small button on it, which we would consider maybe even more of a juvenile or feminine look, but that's the look that they're going for. You want to be sure that whatever surgeon you choose has some experience with your ethnicity or with different ethnicities, patients that have a really wide base. Your goal is to have a narrower nose. It's actually a different surgical procedure. You know, we're making incisions on the outside of the nose to narrow the base. To a degree, it depends on what part of the country you're getting your rhinoplasty in. We generally recommend that you get your procedure done relatively close to where you are, if possible. Here in the Washington, D.C. area, rhinoplasties start somewhere around the $8,000 mark, and depending on how complex the operation is and how long it's going to take, that cost can go up from there. Most of the rhinoplasties we do here are what are called cosmetic, though there are some indications for rhinoplasty that are also covered by insurance. Usually the external appearance of the nose are considered cosmetic, meaning that insurance does not cover that. And the internal appearance, if you're having problems breathing or restrictive airflow as it goes past the septum, sometimes insurance will cover those. There can be a combination of two. So a patient can have an external rhinoplasty doing it for cosmetic reasons, like they have a bump or something they want to get rid of, and they also have trouble breathing. Their insurance company may actually cover the septoplasty. Recovery after rhinoplasty is relatively short. Even though sometimes people look a little rough, they're usually not requiring much pain medication. And so you'll feel pretty good within a couple of days. You will look okay once the splint comes off, but again, you may still have a little bruising, and you'll be looking, I would say, completely concealable within 3 to 4 weeks. You really need to wait all of 1 year until you have all the swelling out of the tip and you get to see that final refined result. The nose, it's the central portion of the face, and it's not always the only thing contributing to a problem, especially when people are talking about their profile. So consider your chin, consider your teeth and your bite before you come in and see us, or at least be open to having that conversation when you're there, because that can really be a part of enhancing the aesthetic at the same time as doing the nose surgery itself.
Click the link in the description to schedule a consultation with one of our team members through our online form, or give us a call at 703-893-6168.